Hello everyone, I am Dr. Berk. In the previous video, we talked about drug treatment for erectile dysfunction. Now we will talk about shockwave therapy to the penis. Shockwave therapy is actually not a very new treatment. It has been used since ancient times. It was first used in 1985 to break kidney stones. It was very successful and is still in use. It was used in 1999 for heart patients. It was used to prevent heart vessels and heart attacks, and it was successful there. After 2000, it was used by orthopedic doctors to reduce pain and prevent inflammation in the musculoskeletal system. In our case, it was used for the first time in the early 2010s. In 2010, Vardy and his colleagues published a study and they said that we used it and we were very successful. Since then, shockwave therapy has been used all over the world, especially after 2012. The main mechanism of action of shockwave therapy is angiogenesis. What does angiogenesis mean? It means increasing the number of blood vessels in the penis. Now, of course, there are two key veins of the penis. What we are talking about here is the expansion of the diameter of the capillaries coming out of the artery, the increase in their number and the strengthening of the connections between them. So that's the mechanism of action. As a result, the more veins there are, the more blood there is. The more blood there is, the more hardening there is. The basic principle of shockwave therapy is to perform it intermittently in sessions. Generally, 6 sessions are done. 6 sessions are called one cure and it is done 2 times a week. This is currently the best treatment option, the best treatment range. Are there any side effects of shockwave therapy? There are no side effects detected to date. So how is it implemented? In fact, it is a treatment that is very simple to apply. We have a device that generates shock waves. A tidal comes out of that device. It receives the shock wave and transmits it to the penis. And we make certain points over the skin of the penis, in certain doses and in certain numbers. There is no ache. If you feel pain in pain because it technically sends energy at a very low density, there is something wrong. It is not used in any anesthesia. After the treatment is over, patients can return to their normal daily lives. Do we apply this treatment to everyone? We don't apply it to everyone. Theoretically, it's technically a treatment that can be applied to everyone. But especially patients with mild, moderate erectile dysfunction who have benefited from drug treatment are our targets. We have a high success rate in these patients. Don't we apply it to seriously ill patients? Of course, we do, but our expectation of success is a little lower in these. The success rate ranges from 60% to 80%. It's a bit dose dependent. What I mean? While the success rate is 65% in patients who receive 6 sessions, this rate can be up to 75% in those who receive 12 sessions, and up to 85% in those who receive 18 sessions. So are we going to do 18 sessions for each patient? And the answer to that is no. This is what I do in my daily practice. After identifying the appropriate patient, I give shock waves 2 times a week, 3 weeks, 6 sessions and call them for control after 1 month. Why do we call for a checkup after 1 month? Because our minimum time for veins to form is 1 month. A month later, if there is no improvement when the patient comes, I do not apply a shock wave again. If there is some improvement, but not as much as desired, I recommend a second golden session. If it is completely recovered, our treatment is already over. As a result, shockwave therapy is a very successful treatment if it is given to the appropriate patient, at the appropriate dose and at the appropriate interval. In our next video, we will continue with PRP, the trade name P-shot, treatment for erectile dysfunction. Thank you.